Hello, I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist, and this is Talk Plastic Surgery, where we talk about the good. I'll look at myself and I'll be like, oh my gosh, I look really good. Oh, I was so excited, like super excited. It was life-changing.
I think it was a positive for me. I thought about it for a long time, and it's something I wanted to do for me. I was really excited, honestly, about this procedure, and I didn't come down with any weird depression or anything like that. Thank goodness.
Since I have this done, I now have a rounded little. My husband loves it. Yes.
Yes.
So
Yes.
it's enhanced our evenings together and stuff and things. So we're happy. We're very happy.
It's a boost of confidence.
I
Because
love to hear that.
yes, it's something you do for yourself.
Yes.
I didn't do it for my husband or for anyone else. It's
Yeah.
for me. I think it's just something that if it's bothering you about your body and you can do it, go ahead and do it.
The bad.
It's funny, after a couple of days, you get up and I'm looking in the mirror and I'm thinking, geez, this doesn't look like a BBL to me. How is my BBL going to come if it's not there?
Before I had the surgery complication, I was very ecstatic about the results, loved the way everything looked, and then all of a sudden, overnight, things changed. I was so disappointed. It definitely did play a role on my mental health.
I had been wanting it for years, possibly about 8 years. Did that kind of scare you before going in? That was terrifying. Yeah. That was really scary because he had no idea what I was getting done. And he's like, oh, okay.
How did both procedures affect you emotionally?
The first one, I was really trying to prove to myself and like the person I was with at the time, like, this doesn't faze me.
And the ugly.
They said we had to do a lot of repair, extreme amount of repair. And I was like, okay, well, what does that mean? I couldn't look myself in the mirror for 8 years.
It turned out to be a disaster. I cried, literally. I literally cried because it was unbelievable. It sets you back like you're worse than what it was.
And she just shared with me the truth.
Yeah.
And that's what we need to know. And know that this is a common but thing. You don't want to live with it. It's not fun. It's not comfortable. You're miserable.
So I would say about 6 months after the first procedure, I was like, there is something wrong. This is not right. And you just are like, how could this happen? Why did this happen? I'm such an idiot, and then it affected my sex life for sure too.
And we had also some very special guests come on the show as well.
When women are like, well, I'm going to wait. I'm like, but why? Why wait? You're only this age right now and that's it. Why wait? Why not feel your best right now? And you want the BBL, you want the Lipo, go get it. Go do it, girl. Do you.
I feel like as a single mom, sometimes we want to look good and we try so hard and, focusing in our children that we forget about ourselves. Not to, because you want to make yourself look good to please others, but for yourself.
Trust your plastic surgeon for what your plastic surgeon wants, but also ask your plastic surgeon at the consultation what your recovery is going to look like. Allow yourself to recover. Allow yourself this time. Like I said earlier, the one time you have been people pleasing since you were 6 years old. It's time to let people please you.
And this is episode 20! Episode 20, Pumpkin! Episode 20, Pumpkin! Woo! Go back up. And on this filler episode 20, this is actually the ending to series 1. So after every 5th segment, then we will begin a new series. And I can't wait to tell you at the end of this episode what series 2, some little sneak peeks into what series 2 is going to be. So let's begin our series finale, episode 20, and go over everybody's beautiful stories. In this series, we had some of the worst stories.
Turned out to be a disaster because I ended up with multiple puncture wounds in my body, in my back, actually.
Yeah.
And it was supposed to have been a woke procedure, but I was asleep. They booted me out in the cold night, lethargic, you may say. It was a traumatic situation. When I met you, you made the results a lot better than what the procedure itself.
And what those mistakes are, I'm not sure because I'm not a professional, but I knew there was something wrong.
Yeah.
So they do this revision surgery. And mind you, I'm awake the entire time.
Also, you were on your local.
Yes, local for the revision. And this is what he says to me as he's standing over me and I'm looking up at him. He was like, make sure you stay the weight because I'm not doing this again. And he cursed too. And I was just like, oh God. I was like, Amber, just shut the up and, just get it over with. So as he's puncturing me with all of the numbing, whatever it is.
Yeah.
He's, and it's painful. So I'm like grimacing and then he's just kind of like talking shit to me the whole time. Like it was not anything that was like completely out of line, but it was just like the whole bedside manner. You could totally tell the ego was there. And like, he just didn't give 2 shades of shit about me or what I was feeling. So I'm just sitting there and I can remember he starts going and I tell him, hey, I can still feel that. And he was going up pretty high on my sternum right here. And I was like, I can still feel that. And I'm telling you, it felt like a needle just like piercing through your skin. And he was like, well, if you can feel it, then I guess we're just not going to do it. And I was just like, what? Oh my God. And I'm like, no, it's fine.
What?
I was like, I'd rather get it done. I'm like, I can deal with the pain. Just go for it. Like, I'd rather get it done. And the whole time,
What
it was wild. So I'm like sat there and I'm just like, please just like let this, I'm meditating. I'm just like praying. I'm doing my thing. I'm just trying to get through it. And I was like, this guy, and I knew right then, I was like, this is gonna not work. Like you're gonna have to figure something else out after this because this isn't gonna be the fix it to this problem.
So in Venus and Amber's episode, they are some of the most special episodes that I have on this filler and to speak about again, because one, when you go and trust yourself in a doctor's hands and you're expecting to get not only a specific surgery that you paid for, then you come out and you don't even get that surgery. And then 2, to be completely dismissed and just booted out, never speak to the surgeon again, and basically kind of feel like you went to like some back alley situation, right? And then an Amber situation where in an essence, you were betrayed by someone and violated. I think, honestly, that's the best word. Violated by a surgeon that you felt like you put your life in their care. And this is a very emotional thing. Now that we're on episode 20 and we're actually diving deep into plastic surgery and people's experiences, and not just people's experiences, but professionals speaking about plastic surgery now. This is an emotional journey. That is a question that if you've been watching the show, we ask a lot. How does this affect us emotionally, right? So when you are putting yourself out there and your life in the care of these surgeons, and you're being treated so awful and emotionally like just wrecked, like these are things that we have to speak about. And that's why I wanted to bring their situations back to light, to just kind of share with all the viewers that you have to do your research, and you don't want to go to a surgeon that is not going to treat you like family. That is probably the number one thing that we could take from all of this, and also spread the word so that these things don't happen to you. And now let's talk about Sherry and her 5 breast surgeries. Right, Pumpkin? Exactly.
You get this capsule contraction. It almost distorts the implant.
Yeah.
Because it
Yep. 100%.
clamps down on the implant. And if I would have known
back then what I know now after 5 surgeries of replacing these implants over and over, I wouldn't have had this problem.
Yeah.
And the main thing is through, Sabrina has taught me so much through the massage. And I never even knew that there was breast massage. That you think, oh, regular back massage or full body massage, but you don't think of a breast massage. And when I first came to Sabrina, this is after 5 surgeries. I was desperate, and I was had just had my last one, probably about, it's almost a year now.
Oh my goodness, almost a year already?
Yeah. And
Wow.
I have not had any capsule contraction. If in fact they lay beautiful, they're very natural. I've not had any problems, and it definitely is because of her massage, this breast massage.
Now, shedding the light on breast massage and breast recovery, why is it important? So after Sherry's episode aired, and I have to say Sherry's episode was probably the episode that had the most views in 1 week that we had out of like every single episode. And I feel like and she even said it, that a lot of us get breast surgeries. Like, breast augmentation has been around forever. It's probably one of the first surgeries. I should actually research that and see if it is. And it's something that is so untalked about, but something that happens so much, from breast cancer patients to normal healthy women wanting to go and have their breast augmented, and also not realizing that it is very common to have complications with your breast surgery. A lot of surgeons tell you, oh, like, you're good. You can go in, you can have your breast done, and you'll be fine. When in reality, most people end up getting capsular contracture. And when you get capsular contracture, then we're dealing with a whole other wave of issues. And now where I'm at in my career, I can literally look at some breasts and I can tell you if it's capsular contracture, if it's a flipped implant, or if there's other types of issues going on and that we need to fix. So in that situation, we are going to talk even more about breasts. And that will lead me into a little sneak peek into later. And how can we forget about the lovely Dawn?
And after all of the weight loss journey that I went on before this, which I lost 150 pounds on my own, no help.
Congratulations, by the way.
I'm very proud of that.
Yes, yes.
How do you put an implant in backwards? You're supposed to know what the hell you're doing, right? Like, I mean, come on, front, back, what's going on here?
I know. One part's literally flat.
Before, I think, our first massage, I can remember you pushing here and the liquid was just sloshing everywhere.
Literally like a waterbed, right? Your whole chest is like
It was, seriously. And it was, I don't think I look bad, but you can only imagine.
And a lot of it's boobs, too.
Well, yeah, it is. Happy for that. Do you understand what I have to do to work this time? I'm sorry. Not excuse my French, but you know what to do.
No, it's okay. We'll beep that out in post. Okay.
So recently, Dawn had a situation, and so she is going to come back on the show. I know that we were supposed to go to Mexico in January, and one thing is that is going to have to be on hold for now. That being said, I can't wait for you guys for series 2 to see Dawn come back in the hot seat and for us to go over some situations that have happened to her and why it is what it's going to help you guys, especially when it comes to breasts. And we also talked about BBLs on the show, guys. So let's talk about BBLs. We had a good BBL story.
Most important thing, the third thing, is the post-op care. Don't just get your procedure and think you're fine and I'm good now. No, there's a lot that comes with it afterwards. And I think that's why I'm still happy with my results, is because of you, 100%. So I honestly couldn't imagine anyone else like touching me after my procedure. You were so gentle, so caring and genuine and so professional. And like, I can go on and on and on. I don't know if this podcast is about like why I love Sabrina so much. We can make it that. But
thank you. I love it.
5 stars all the way from everything. And I really do believe that you know, everything happens for a reason. And that day I called like 10 different people and I just couldn't get through. I didn't have service. I was going through the windy like desert areas from, you know, and I couldn't get through, and I finally had service and no one was answering. And when I called for you, it was like you answered, and it was like, it was just meant to be, you know? And not only that, like we've built a connection beyond the massages, which I think is important too.
Yes, that's honestly why I love doing what I do and seeing the journeys, and especially when I get patients like you that come into my life and now years later, like still having a friendship. And it's been an incredible journey, and thank you for letting me be a part of it.
Thank you.
And 2 years later, it's like I can't brag enough. Still looking absolutely incredible. And a bad BBL episode.
You know, you get up and I'm looking in the mirror and I'm thinking, geez, this doesn't look like a BBL to me. Like I looked, and because again, this was new to me, right? Yeah. I was expecting a BBL, like your butt is supposed to be very voluptuous, very full, but I felt like I was very full in the hips. And mind you, I've always had an hourglass shape, right? It's not like I was ever, you know, not voluptuous to begin with, but I wanted a little bit more enhancement. And I didn't see that with the faja, which was kind of strange to me, but I thought, okay, well, I'm not going to judge. So, I mean, the bad, as you put it, Sabrina, and the ugly in the mud didn't come till months later when, because the procedure, what they did was they took the fat from all areas of my body. They took it from my legs. But they told me, do not get any massages. You just lay, don't do anything. You can walk, don't exercise for so many weeks. So I took it easy, did exactly what they told me. And fast forward, I hired a coach for training. I trained with, it's every day, like 4 or 5 times a week. And I went back for my consult and I just said, something just doesn't look right. I look like uneven. One hip was higher than the other. And I said my legs looked it was almost like I had, not cellulite, it was almost like I had bumps underneath my skin, something that I didn't have before I started. And they said, I met with the surgeon and he said, you know what, we can't do anything else. Just keep exercising, keep, eating well. Eventually that's going to go away. But in my mind, I'm like, how is my BBL going to come if it's not there? And how are these bumps in my legs going to go? Should I say get massages or no? So that was, it's been a learning curve. That's for sure. A very expensive one.
When you see 2 completely different stories of their situations and what they went through, and Patty, of course, she's always saying that, do your research if you're going to go to any surgeon. And thankfully, Patty is on the right track. Like she's doing amazing. She's looking amazing. Finally, she's correcting a lot of the bad stuff that happened with the first surgeon. But then when you look at Natalia and how she had just an incredible experience from the beginning to the end, and almost 3 years later, still having her BBL, still looking amazing. That is kind of the direction that you want to head in. So if you're watching this and you are planning your surgery and you're wanting to think about like what kind of like direction you want to head in, the obvious one is make sure you follow the 5 keys. You got to follow the 5 keys to recovery. Nutrition, massages, compression, exercise, mindset. And I'll put the link below to my video about all the 5 keys to recovery, which is what Natalia followed. The other reason why Patty didn't do that in her original surgery is because she wasn't guided in that direction. And that's what we talk about in Patty's video. And so now she is. And now she's looking absolutely incredible, stunning in every single way. And we can have to have her back on the show when it is time for her to come back on the show. So with that being said, one, there is no BBL smell. Let's just put that out there right now, okay, guys? So as we're on the subject of the BBLs, that is one thing that I just want to say. There is no BBL smell. So go get that BBL if you want to. And of course, as always, follow the 5 keys to recovery. Make sure you're starting with your massages. You're starting with nutrition before you even go into having your surgery. Make sure that you are having the perfect proper compression. If you get wrong compression, then it can ruin your results just as well as if you're not eating right. So surgery is such a meticulous thing that if you mess up one little thing, it can literally damage your entire results. So make sure, guys, that you are following the 5 keys so that you end up years later looking incredible, just like Lipalia and just like how Patty is now. So, guys, this has been such an incredible series. There's so many stories that we went over. The beautiful, let's start from the top. So the beautiful Patty, Dawn, Jennifer, Natalia, Sarah, Venus, Angelica, Azul, Sherry, Natalie, Sydney, and Amber. All of my gorgeous, gorgeous patients that I'm so grateful and thankful to you guys for coming on the show. I have Noe brushed up on a few of you ladies, and anyone who's watching this show. We're going to include everybody's stories in the bio that has kind of what they went through and stuff, so it can guide you guys easier if you come across this video into your research and what you're looking at for your health. Of course, we had some beautiful, incredible professionals come on the show. Michaela at Divine Med Spa, Jess with Tender Touch, one of my teachers who's also a practitioner here in Vegas, Kathleen Leeson, someone who is a mogul in the industry who definitely a lot of us therapists look up to and know. And if you are a plastic surgery therapist, you know of Kathleen and you know like the wisdom that she shares on social media and has helped so many people. Thank you guys so much for coming on the show. I really appreciate you. And as always, if you are looking to go ahead and optimize your health, I'm going to include my website down below. If you have any questions, you can go ahead and hit the link. You can reach out to me, and I do video. So if you want to schedule a call with me, I will do that for free. If you want to do a video, I do have to charge you for that because that's 30 minutes minimum. So feel free to schedule your free call, or you want to schedule a video, you can, especially if you're not here in Las Vegas. If you're here in Las Vegas, however, then you already know if you want to go to the best massage therapist in town for all of your plastic surgery needs, feel free to reach out to my assistant. And as always, have a beautiful night, day, morning, wherever you are. This has been such a wonderful episode, episode 20. And just to end it, Jovi, play the bloopers.
Hi, I'm Sabrina, and this is Talk Plastic Surgery. And right now, we're on.
Some people will be happy about that, honestly. Yes,
I know, definitely.
Yeah.
But wow, so okay, hold on. What that out of post? Let's do some rapid fire questions. What? Ooh, rapid fire questions. So without further ado, please welcome Amber. Welcome, Amber. Yes. How about let's start some rapid fire questions?
Uh-oh.
Rapid fire questions. Okay.
Wait, I didn't know this was gonna happen.
I
I think the doctor should take some of that fat out of his head and stick it to somewhere else because he's not a smart man. No, all right. Edit that out.
Okay. Yeah.
Would we say Taylor Swift?
Hi, I'm Sabrina, and this is
Sarah.
Arms. How long did you wait before you decided to go and have the surgery done?
Hell yeah, it is. Happy for that.
What do you mean, liposuction?
Yep, liposuction.
Like who needs to get?
Yeah, yeah.
Who needs to slim down?
Yes. Actually cause dents and cause more
uneven. Do you mind if I call her real quick?
Yeah, no,
Sorry.
no, go ahead.
Yeah, I just.
No, it's okay. That's why we, my assistant, she'll just cut this part out.
Work with dark pig, with light pigment, any skin tone, any issue.
I tell Jovi to cut out different areas, but I wanted to look at some questions.
Jovi's the best.
She literally is the best, literally. Yes, thanks, girls.
Dude, I kept finding out on so many of them.
And thank you so much for coming in. I really appreciate you. Thanks so much, girl. Thank you so much for doing this. Hi, I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist. And this is Talk Plastic Surgery. Talk Plastic Surgery. Talk Plastic Surgery. Talk Plastic Surgery. Where we talk about the good, the bad, and the ugly, and the ugly. On that note, let's do some rapid fire questions. Now let's start some rapid fire questions. Rapid fire questions. Woo, rapid fire questions. 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 So, yes.
And was that not hilarious? Oh my God, I'm gonna tear up. This was such a good series one. All right, guys, as always, like, share, subscribe, hit the push notifications for all things Talk Plastic Surgery. Bye.